fungal infected fodder. And sometimes in Sagar, when I was a veterinarian, I used to see that prolonged estrus syndrome. The animal used to be there in the estrus for more than 5 or 6 days. We used to use, and it never used to ovulate also, and sometimes metastral bleeding was also observed. And at that time, we found that the farmers are feeding the fungal infected paddy straw, which was one of the fungi which was secreting the zearalenone. It is a just like estrogen like material, and it was causing the prolonged estrus syndrome. Immediately after withdrawing of that particular paddy straw and administration of some mineral mixtures and some of the hormones, it ended the toxicity of that particular situation. There will be clear estrus, and all these things, you know, the cattle, commercial cattle feed into dermatitis is caused by nothing more than it was attributed to the urea. It is not the cause of the dermatological disorder like this. The de-oiled rice bran allergy is the main culprit for this type of the disorders. So, dermatological disorders usually they respond, so many causes are there. I will not go into the deep. Once again, it is a very big problem, non-responsive dermatological disorder, such a big list is there. So, I will go easily, and for most of this thing, especially of course the fungal, parasitic, viral, congenital, we have to diagnose it properly, then treat it accordingly. But this treatment is very good for most of the cases. Sodium thiosulfate, the sulfur containing amino acids, they are serving better, and also the zinc. Zinc is one of the most important thing required for the skin, and zinc oxide also you can give, or zinc tablets are there, and some of the mineral mixture do not contain the sulfur or zinc. So, please choose such of the preparation. It is always available in your hospital itself. Sodium thiosulfate, copper sulfate, ferrous sulfate, magnesium sulfate. So, this is the mixture 1 kg you can make. 20 gram twice daily for 15 days will usually subside, and external application of the sulfur and zinc oxide in 1 liter of the neem oil, always better in most of the dermatological disorder. If you do not know the etiology also, because we are using ivermectin for all the type of the dermatological disorder, which is not at all a correct thing. And zinc responsive dermatitis is very common throughout Karnataka state is concerned, and also the deciding states. Zinc responsive dermatitis, especially in case of cows, it is very common. Gangrenous mammalitis, once again you are all encountered this thing. It is a herpes virus induced infection. So, very common in case of buffaloes. Only in the initial stage, if you treat, some of the animal may recover, and later treatment will not cause the recovery, because it is a virus type of the infection, and acyclovir is one of the drug that can be used in the initial stage, but not in the later stage. Nowadays, it is very well established that ivermectin, we do not know how it is going to affect, mechanism is not known, but ivermectin is also effective against such disorders. Mammalitis, I think it is a very common situation, but 4 doses of this thing, especially ivermectin, herpes virus, this thing. So, once in a week, 7 days, because it will stay in the body for 7 days, or once in 10 days, 3 or 4 injections will make the animal to recover. It is very, very slow, and only one thing is, we should never attempt for milking from that particular teat, especially in the buffaloes, or else the sloughing occurs, and also the buffalo calf should not be let for the suckling. These are the 2 important things, and so many treatments are there, because it is a viral disease. Everybody has done the trial and error, but some of the proved treatments are the ivermectin is one, and lithium antimony thiamelate is also one of the thing. Deep intramuscular injection of lithium antimony thiamelate also give a satisfactory therapy, because see this especially the buffaloes, heifers are affected most of the time, the mammalitis. So many causes are attributed, especially in case of first calving buffaloes, the receptor, estrogen receptor are not so stretched, and then later when in the case of the primiparous animal, whenever there is a high estrogen content, the virus will invade very fast. Some of the reasons are told, but the exact etiology is not known. So many plants are also there. Kneeling syndrome is also another mycotoxicosis syndrome which happened in Jamkhandi, and please note down all this clinical science so that we can do the further research in collaboration, because it requires lot of research also, and research is a very costly hobby, as everyone know, because it requires so many equipments, and also the PG students are required for properly conducting the research. And especially colleges, what happens, our most of the time is dedicated in teaching, and our component is teaching, research and extension. Three parts are there. Just like you, we are also burdened with so many other unwanted works also, like giving the reports and also evaluation. Then many of the students fail many times, and we used to conduct the exams and take the classes entire year. This is the thing, and we will get very less time. And research is a hobby, and we cannot force to the every teacher. So hobby, can it be imposed on every person, because every person's hobby is different, and research is a costly hobby. Getting the funding is nowadays very difficult. Government of India almost stopped the funding to the research projects, because they want the direct result only, directly to the and basic researchers they are not going to give. And government of Karnataka, we can never ask any funds nowadays. It has happened. It is totally bankrupt, and most of the money, the second installment etc., never have been released in this year. So it is very difficult at that time, and the private companies, they will sponsor for their own products only. So nowadays it's very difficult. Only among 2 or 3 staff among 100 may conduct some of the research work as a hobby itself, or else it cannot be forced. So this is the situation, especially in India. And another alarming situation in India is the budget allocated, especially in the union government, is just 0.59%, 0.59% of its GDP contribution, whereas the animal husbandry sector is giving the contribution to the extent of 12 to 13% to the GDP, and we are getting back 0.59% to the research, and also less than 3% for the animal treatment. So that's the scenario is there, even though it's a livelihood of most of the animal. I do not know who has to convince the politicians etc. And the agriculture, in the agriculture itself, the